You'll know when you have a wild woman. She'll practice her craft without boundaries. She is truly autonomous. Her loyalty is only to the family she serves, a midwife who will not allow herself to be held back by a system she didn't create.
This podcast is for the birth keepers who want to grow and change. We are open to learning through self-reflection and supportive community. We are creating this space to explore without judgment. We are remembering we were
Born wild. Maybe you can start with a little introduction on who you were, who you are, and
Absolutely.
what you do, and why you're here.
Yes. Absolutely. Yes. Thank you. Thank you for having me. So I'm Alicia Roberts, formerly known as Alicia Willoughby. I recently went through a divorce and I'm changing my name back to my maiden name. So my name is changed in my personal life, but my professional life is still going through the transition of changing. So it's important to bring up both names because I've had my business for 5 years now as Alicia Willoughby. So this is a big transition over, but one that I'm really dedicated to reclaiming back my maiden name. So I am now Alicia Roberts. I'm an orthopedic and women's health physical therapist who specializes in prenatal and postpartum bodies. And I have my own practice in the San Francisco Bay Area, and 95% of my clients are bodies who are either pregnant or have had a baby at some point in their lives, whether that was only weeks ago or decades ago. So it's my passion, my mission. I love what I do. I feel so blessed and honored to do what I do to support women and postpartum bodies and prenatal bodies to really feel good in their body and fill the void that I believe that the traditional medical model is really creating for us all as we go through this process and are not getting the care that we really need and deserve.
Yeah.
So it's so important. How did this all come up for you? How old are your kids?
That's a good question.
Before you had children, because you had children, like where did it start?
Right. A little bit of both. I've always been fascinated in pregnancy. Even before I had my own kids, my mom was really vocal about her own birth stories. And so I was always really just fascinated and couldn't wait to go through it myself. But then when I didn't set out on my physical therapy journey to do this. I started out in your traditional outpatient orthopedic neck pain, back pain, surgery role. And then really early on, I actually started with one patient who walked in the door and she was pregnant and she had back pain. And she just happened to be on my schedule. And I was nervous because they don't teach you much of anything in physical therapy school. And I thought, you know what, like I know how to treat back pain. I can do this. And through working with her, I realized how many women were being told that back pain was normal and they were being dismissed. So that's really where it all started. And in that first year, I graduated from PT school in 2007. And I did an extra coursework to learn just the basics about pregnancy and postpartum bodies. And then it all started with marketing myself in San Francisco to the OBs saying, hey, if you have a woman saying she has back pain, send her to me. Don't tell her it's normal and it'll go away. So that's where it started. And then when I moved to Marin and I got a different job, same thing, orthopedics, but I started to really pay attention to the bodies that were walking into my clinic with back pain, knee pain, neck pain, who also had babies. I started seeing this common theme that they had a lot of unresolved postpartum issues. When I really started digging into it further, they were leaking urine, their core was really unresolved. So I started really noticing that a lot of their injuries were likely could have been prevented if they had gotten postpartum physical therapy earlier. And then in those years, I had my 2 kids. My daughter's about to turn 11 next week, which I just can't believe. And then my son will be 9 in June. And so through that experience in my own body, I thought being a physical therapist, I wouldn't experience things. And I did in my own body. I thought I could rush the postpartum healing experience. I can't. Nobody can rush it. And being in the medical field already, I also felt disappointed by postpartum care. Now, you guys both know I had like amazing prenatal and birth and postpartum care from my amazing midwife. But that still ends early. And I was just like left and felt like, well, nobody's asking me what's going on with my body. And I'm 8 months postpartum and I don't feel like myself. And so that was my own experience within the medical model, realizing that even being a medical person myself, I still needed more support. And then it was when I decided to go out on my own that I realized I wanted to do my women's health specialty training, and my previous employer didn't want to pay for that. So I was like, you know what, I'm just gonna go out on my own and do it myself and really go after my passion of working with the bodies that I want to work with. So it's a little bit of all of the above, of interest in it before, always being interested in women's health, always being an advocate for women's health, and then finding this place where I could really fill that void in women's health. I always thought I wanted to be a doula, and I had a lot of friends telling me that I should because I love birth as well. But I realized, this is actually the void that I need to fill for birth support and postpartum support.
Well, there's a reason why. I mean, and this is I've mostly practiced in Marin and in San Francisco. I'm doing more up north. That I refer everyone to you, because you're fabulous and everybody loves you, but there's not a lot of you,
right.
know, like, and there may be more in the city, but I'm usually like, I just kind of keep it in the Marin.
Yeah.
Part of the birth circle that I'm, that I've known.
Yeah.
And people give me such great feedback, but it's telling. Like, many doulas that I know. And we need them, right?
Yes.
There's so many doulas.
Yes.
So great, but there aren't that many of what you're
right.
doing.
Right. Yeah, there aren't that many pelvic floor physical therapists to begin with, and then on top of that, a lot of them do the whole scheme, the whole variety of pelvic floor. I don't do male pelvic floor. I don't see a lot of chronic pelvic pain. I don't see a lot of like postmenopausal pelvic floor issues. So I just lost there we go. So not many people do just the specialty of prenatal and postpartum. They can, and they can do all of that, but that's really all that I do. I still see the pelvic pain. I still see all the other issues, but it's tied back into the pregnancy and birth experience.
Yeah.
So has your practice transformed over the years? I know you just talked about where you began. Do you have like a different spot where you're at now, like what your focus is on? I know you've done a lot of, we were talking about like body positivity and stuff like that.
Yeah.
Dancing.
Overall, overall the clients are the same. One thing that I do more of just clinically wise is a lot more birth preparation appointments, and that's mostly just been my evolution of it, which I love, is doing the birth prep work and taking everything that everyone learns in other ways and giving them that physical experience of it. And that for me also blends in the body positivity, the birth positivity, the confidence, the body confidence, like that. I bring that whole theme into the birth preparation work as well. And then, I guess that's a really great question. I guess I can say that through the years of my own practice, I'm more comfortable talking with my patients and my clients about the other aspects of what's going on with their body, right? Because we know postpartum, someone comes in postpartum, they're in there, because they're leaking urine and they have core weakness. But then there's also more issues about it. They're asking me, when are they going to lose the weight? When is their belly going to look the same? Is their body ever going to look the same again? I had someone just last week, 7 weeks postpartum. I haven't lost the weight yet. So I also will bring forth that education on, hey, like that body that you had before had never had a baby. You're not getting that body back because it never had a baby. And let's bring in the appreciation for your body now. And I think something that I really give my clients is that unfiltered, like real life, like mother to mother, like, yes, this is hard. I have my own self-practice of body love on my own all the time. And some days I rock at it and some days I don't. And really giving them that real look on it, because we know that society tells us after 6 weeks we should be able to fit into our skinny jeans again. So there's a lot of that goes on. I do a lot of return to sex work with the physical body, right? Like the pain with intercourse because of vaginal tearing or pelvic floor spasms. But then that brings up all the sexuality piece, right? And like I get to be that person that gets to talk to them about their fears about returning to intimacy and how they're feeling about their own body and how they're feeling about themselves as a sexual being now that they are a parent. And that piece I just absolutely love because we get to talk about like more than just the physical part about sex. And I get to give that coaching of, yeah, okay, so you want to get back to this, but what are all the things you can do first? And like that advice. And they're so appreciative because all they're being told is like, okay, you can go have sex now. And they're like, ah.
Well, it's like the difference between sexuality and sensuality is very different.
Exactly.
Yeah. The midwives have a joke too about the 6-week appointment and like the mom just waiting for us to say in front of the dad that it's safe to have sex. and when in private or whatever, I mean, I would say this in front of a partner, but it's like, girl, it could be a while. It's fine.
Yeah.
You know, it's not something.
Yes.
I think I was 6 weeks postpartum. When I started having sex with my ex-husband, after my first daughter, it was like excruciating, like stabbing, horrible pain. And I went in, and the nurse basically was like, well, must have torn some kind of nerve. And, you know, there's something where you can inject numbing medication into your like vaginal canal. And, you know, it was yeast infection.
Oh,
I treated and it was yeast. And I was like crying, like I'm going to have to inject my vagina with numbings, you know, and it's just this whole where it's like, it's a problem, you know?
Yeah. Right. Yeah. I feel like my work a lot of times is normalizing the experience, normalizing the feelings, normalizing the experience. And then, you know, the other thing is I deal with a lot of the postpartum birth trauma experiences as well. Yeah. My evaluations are 90 minutes on purpose because especially for a postpartum body, they need time to tell me their birth story. It's not just like, okay, did you have a vaginal birth or C-section? Okay, great. How old is the baby? You know, I mean, I want the whole story because you know what, how that body tells me about her birth, the first few words out of her mouth tells me everything. Everything that I need to hear. I mean, it's like, and it's a process of listening to the story, listening to the words she's using to describe her birth. I'm kind of a body reader. So I'm like reading the way her body is telling me. And then what I will tell them is that you're going to tell me your story. And then your body's also going to tell me your story. Yeah. And so with a lot of my clients that say, for example, have pain with intercourse, or even just have they want to heal an abdominal separation post C-section, but they can't even put their fingers on their scar yet. Like then we're dropping right into birth healing work and breathing through and accepting that scar and letting the tears come up. And I've had body after body, that part of the work is training the brain to realize the birth is over because they're still in a traumatic state and they don't tell me that. They don't know that. I just had a woman I'm working with right now and oh my God, it was so great. My first appointment I was working with her and trying to get her to breathe down into her scar. And we were, you know, I was using specific words to kind of help her. And she just said to me, she goes, oh my God, my body still thinks that it's birthing. And I'm like, yes, it still thinks that it's birthing. And that's why you can't let go of this tension through the bottom part of your body. And that's again, another place I can say that it's like, I feel like when I worked in the clinical world, when I took insurance and I was in that like clinical setting, it was all about like, what will the insurance pay for and being a clinical physical therapist. And now in the space that I'm at, like, it's so much more than just that like clinical physical thing that's going on with that body. It's everything else. And so the birth healing work is huge because some of these bodies are not going to feel pain-free until they process that birth story. And giving them that space to tell me about it. And then like, you know, my work, what they're doing with me is also going to, you know, bring in some of that kind of stuff too. Yeah.
Yeah, well, we hold so much trauma and you know, all of it in our body. And we talked about this is like once a woman's given birth, usually unmedicated, they start to shake, right? And it's adrenaline, it's hormones going nutso in the best possible way. But as animals, when we experience trauma, like our body has to process it out.
Right.
And I say this to women who have just birthed, who've had the birth of their dream. It went exactly how they wanted it, you know, there's always a quirk. You want that at a birth, but there's still like in a trauma place, and it's like your heart and your brain and your all of that knows that you just had this wonderful experience, but your body did go through a trauma, and like allow that to be. And it's like, you're not a bad mom. It's not that you don't love your baby and you're not bonding, you know, it's just, and it's scary.
When the body has that much adrenaline, it has to process.
Yeah. And then we're telling women that by 6 weeks, you better be in your skinny jeans and not running, you know, and they're like, what's wrong with me? It's like, you just went through one of the biggest experiences that your physical body, your mental, emotional body, your hormones, like everything has been through. Like, we have to be more gentle with ourselves. I feel like I'm usually the voice telling them, like, we need to slow down and we need to be gentle. You just started the healing experience. This is a journey. I thought I would get to like the end of postpartum, you know, I was like, oh, it's done. I've healed. And it's like, it's just, the journey just changes. It just continues to change as we go through this experience of our postpartum bodies.
Yeah. So on that note, what would you say, like, for pregnant people that are listening, what would you say your tips are for preparing for postpartum?
To find a really good pelvic floor physical therapist. For preparing for postpartum, oh boy. Well, first, I think my clients that have done some kind of prenatal work will their postpartum experience, they can turn muscularly things back on faster, because they've already made that like brain to muscle connection postpartum. My general things with my postpartum bodies are that they need to rest, that they need to take it slow and they need to rest. And I tell them, think of the first 3 months as a slow resting, you know, restorative experience. Just walking in those first 3 months, and then all the things we know, drinking lots of water and good nutrition and all those kind of things. I guess my general messages tend to be just to slow down. Like, the more you slow down postpartum, the better you're going to feel later, versus trying to rush it, because you can't rush it. And then I think for the postpartum bodies as well, you know, the general advice is pay attention to when things don't feel right. Because I get a lot of people that are like, I've been waiting 14 months for this to go away and it still hasn't. So I'm finally coming in to see you, type of thing. And we know, like, we're so intuitive in our bodies. So when something doesn't feel right postpartum, get the support that you need. And if you go to your initial care provider and they dismiss you, keep searching for somebody who's going to, you know, look further, such as pain returning to sex, or, you know, their body's just not feeling good. We should be able to heal fully after giving birth, but we usually are going to need some guidance and support from the right people, you know, to do so. So take it slow, get good guidance. You're not going to be returning to running at 6 weeks postpartum. I'm sorry. Nobody is.
Yeah. I started this year, I think. I added on to my care package. I see all my families for the first year postpartum. Because for that reason, a lot of families, you're just kind of done at 6 weeks, 8 weeks.
Yeah.
And especially during COVID too, a lot of them would say that I'm the only one they're really seeing, you know,
yes,
they live with. And
I get that too.
Yeah. And the conversations that I was having with people at 6 weeks just felt inappropriate in a sense, because they're not thinking about themselves. They're still trying to figure out the breastfeeding thing. And, you know, unless they're having major issues,
right,
not really considering their body at all. So it feels more appropriate, like really like 6 months in or something like that, to talk about these things.
Yeah. At least 3 months. I wish women got a 3 month checkup, because at 6 weeks, I didn't even know like what time of day it was, let alone how my body felt. Like, I was still trying to figure out nursing with this screaming baby. You know, I mean,
you have a prolapse, you're like, I don't know everything.
I don't know.
And different, and
right. No, I think 3 months check-in, a 6 month check-in. Absolutely. I mean, I love that. I love adding on that year. And oh my God, in COVID, I mean, I'm getting clients who haven't even had a physical checkup postpartum. Like, they've had only virtual postpartum checkups. And I mean, don't get me started. Like if there was tearing, if there was stitches and I've literally had people come in and say to me, you're the first person to look at my vagina since having a baby 3 months ago. And it's just not right. It's just not right. I mean, we want that even if you have like, yeah, exactly. Like a gentle birth, like you want to know you're okay. You want to know you're healed, and you want to know what to look out for. If you're not, you want some kind of guidance. And so many of my clients come in and say, I just didn't know what to do. So I went back to A, B, and C, and now I'm here because it's 8 months later and I don't feel good or whatever. Yeah, I wish the conversation could change from that 6-week mark to, if someone has to be discharged at 6 weeks, that conversation is like, you're done with this type of care at 6 weeks. And now it's time for you to see somebody to, guide and support you through the rest of the postpartum healing phase, and stop giving the message that we should be healed at 6 weeks, because we know there's research now that tells us that the pelvic floor takes 4 to 6 months to heal from a tissue injury point of view, not 6 weeks. So we're just setting women up to feel like they're failing in some way.
Mm-hmm. Yeah. So are you seeing families in person? Is everything, I'm guessing it's not virtual because of what
it's not. No, I was luckily only closed for 3 months when I lost childcare. So I've been up full-time running since June of last year, and busier than ever, I think, because people aren't traveling, their partners aren't traveling, and people are a little bit more flexible right now. So it's been a lot easier. There was a little bit of lull. And then I think once people realized like it was time, this wasn't going away. And it was, I got so many people around like 6, 7, 8 months of COVID of like, okay, I'm done taking care of everybody else. I'm going to take care of myself. Mm-hmm. But yeah, I've seen people in person, both in San Rafael and in San Francisco. I'll do some telehealth online, if people need that. But that has really fallen away since people are comfortable coming in now.
Mm-hmm. Yeah, it seems like it would be a hard thing to do virtually, but
yeah, there is more education virtually. There was birth prep like education virtually, and some initial postpartum support virtually. Mm-hmm. That's about all you can really do.
Great.
Yeah.
I want to talk about your dancing. Is that okay?
Sure.
So I knew you from the park.
Yes.
The Marm, which is totally different now. It was like, it was like a roller skate park. All the cool kids hung out there. We would like sit with our coffee and our sunglasses and talking quiet. Okay, I'm going to talk louder. And then my best friend of 25 years, who's a dancer, started pole dancing and doing sensual erotic movement, or there's so many different ways, but really empowering sexuality, and reclaiming your body and your experience. And it was like a holiday event. I think it was Halloween. And then you were right in the room wearing like the most amazing outfit and just like swinging around the pole. And I was like, hello. Like, and then Caitlin, my best friend, was like, oh yeah, no, that's Alicia. Oh yeah, she's amazing. And it was so funny the way that worlds like that collide.
Yeah.
When I break it down, it's like, okay, powerful woman who pole dances, who's a birth worker.
Yeah.
That's basically everyone I know.
Yeah.
All of my friends, some type of dance or, whatever.
Yeah.
So.
Yeah. Yeah. I mean, do you want to talk?
Tell us.
Do you want me to tell you my pole dancing story? Is that what you want?
Just like, how did that even come up, and how does it connect to, body healing?
Yeah. Oh my God. This is such a great timing, because I'm just going to go back in end of June. I'm going to be back in class, and oh my God, I've not had it for a year. I'm going crazy. So I started pole dancing 5 years ago when I needed to find myself again. I completely lost. I guess it was more than 5 years ago now. It's probably maybe 5. It'll be 6 years this fall. So 5.5 years. God. My kids were smaller, and for me, becoming a mom really disconnected me from my sexuality. I felt very empowered in my sexuality before having kids. I was very comfortable in my sexuality. It was an empowerment place for me. I was very sex positive. I had luckily a lot of sex positive experiences in my life. And becoming a mom completely changed that for me. And I felt like I couldn't figure out how to be a mother and how to also be a sexual being. And then my marriage wasn't doing well. There's a lot involved in my sexuality journey with my marriage, and not being able to be my big fullest self. I mean, he won't listen to this, but I was allowed to be a sexual being in the bedroom, but anywhere else other than that, he didn't want it to be seen. And if you know me, that's just not me. Like, I'm a very flirty, like, sex positive person. I'm the person that will talk about sex at the dinner party, and my college roommates and I would be like, oh, let me show you this new position. Like, it's just a part of life. So I looked for pole dancing to try to find my sexuality again at that point. And I found S Factor in San Francisco, and I went to my first demo class and was like, holy cow. Like, I found the language that my body has been looking for. I've always loved to dance, but not like, choreography kind of dance. I was looking for an outlet for what they call your erotic creature to breathe again. So I became a fast, devoted student, and literally just like found the most amazing women there, the most amazing community where we actually, Caitlin and I said this to each other once. I don't know you, but I've seen your soul. Because when you see a woman dance in a way where she's moving her body through her erotic body and allowing all emotions to come out. I'm talking, I have raged in that studio more than anywhere else in my adult life. I have cried in that studio more than anywhere else in adult life. I have processed, my body. I healed a lot of my body issues and body shame issues. I reclaimed my sexuality and my naughtiness in that studio. I processed my marriage ending in that studio. I danced through starting to date again and being like, who am I? How am I going to present myself to the world? Like, who am I? I mean, it healed so much for me and has allowed me to be comfortable being all that I really am. And it absolutely has, more than I talk about, has fueled my practice and my passion that every woman, every body is a sexual being, and we deserve to feel sexual regardless if we have a partner or not. And I tell my clients, there's whatever relationship issues that I hear about, I say, look, I'm here to make sure that you can have sex, the kind of sex that you want, pain-free and as pleasurable for you. I had a woman just this week be like, my orgasms aren't as intense. I think it's a pelvic floor issue. I'm like, awesome, let's figure it out. And that you can reclaim sexuality as your own. I know the desire issues that come up after having babies and libidos and all of that. I know that that's real. I went through that too. But at the end of the day, like, we are sexual beings, and pole dancing has been the place where I could safely reclaim that. And I'm about to just to kind of blend that all together. I'm, rebranding my business, and that's going to be hopefully come out June 1st. My new website will be up and everything. But I'm going to start doing, I'm going to put on a new hat, and I'm doing some motherhood sexuality coaching, because women are talking about this stuff in front of me, and I don't have enough time to deal with both the clinical issues and the pieces that I'm seeing. And, there's a lot of sex coaching out there, but this is really blending the world of being a mother and reclaiming yourself as a sexual being. And it comes up so easily as, like, a client says to me, I don't want my husband to touch me. And I go, well, how could he touch you? Where it could be restorative to you and not feel like one more thing you have to do for him. And they look at me like, oh my God, yeah.
I asked that?
Yeah. And like, I had this woman go, I'd love to like just put my head on his lap and have him touch my hair. And I'm like, then do that. And she emailed me back like, oh my God, we did that. We were watching TV and we were both so happy. And that comes up with like the return to sex. Like, let's take penetration off the table. What kind of touch would feel like an intimate way that would feel pleasurable to you? Would it be a massage? Would it be your partner kissing your neck? And that comes from my own journey, but also the hundreds of women that I've had these many conversations with. But pole dancing is absolutely a big part of that. I mean, this isn't video, but I have like framed pictures like on my wall behind me of me on the pole, because it's where I feel like I can actually be all of me. So thanks for that question.
I was like, can I ask it?
We're
What
like,
you want me to?
We're like, Leah, just don't start the conversation that way. She was like, how soon can I ask this question?
I know. You know what? I'm such an open book person though. And I think that's another part of my practice that's like more and more. It's like you have, you know, when you just are honest about who you are, it gives the people in front of you permission to reclaim who they want to be too. And it took me a few years to start telling clients. I'd be like, oh yeah, I do a dance class in San Francisco. They're like, what? I'm like, pole dancing. But it's so powerful.
Yeah, I did a couple
so
classes.
Powerful. I love that.
When she was 2.
Um,
Great.
So fun.
Emma, were you gonna?
I was looking at the time. I wanted to ask you, we do a couple like kind of silly questions at the end.
Awesome.
So I was just gonna see what you
Now I'm nervous.
What's your least popular opinion?
Oh gosh. Professionally or like to my kids?
Anything. Yeah. Anything.
Oh, this is
Like
a hard one.
Because
Say
you
it again.
or
Like maybe like a controversial opinion, like something that you feel true for you that other people might disagree with, or
Is George Clooney hot?
Yes. Yes.
I
I don't know. God, this is a hard question. I mean, I don't know. I don't know if I know the answer to that.
What about your kids?
Oh, that they can't have screen time after school. I mean, I don't know, but maybe I don't think enough things are controversial that other people do, you know? Because yeah, there's a lot of things that I just feel like the rest of the world thinks are taboo and controversial, and I just think are the way that we should be. I'm controversial every time I bring up sex at a, you know, talking at a dinner party, or, you know, believe that it's okay for my kids to, you know, see me naked still at this age, or see me change in front of my boyfriend. Like, yeah, like he sees me naked and it's not a big deal to me, and let's normalize that. I mean, so I don't know. I don't have a really good answer to that.
that's a really good one.
Yeah. Yeah. I mean, we're all bodies, right? And if my kids can just see that that's normal, that it's not a big deal. I don't have to hide my body from them, and I can get changed, and he sees me and they see me, and now it doesn't even faze them. And it's like, good. Yeah.
Mm-hmm. All right, I'm gonna just throw this one out there. If your belly button had a superpower and you could press it and something would happen, what would it be? Like anything. This podcast took a turn.
My that I could clone myself. Is that
Sure.
Yeah, I need a clone bad. Yep.
My kids would abuse that power. They would touch me and just let me serve them.
My kids ask me, it's sweet, but it's also, you know, working mom struggle. They're like, Mommy, my daughter once asked actually for a clone, because she wanted the clone to go to work and for me to stay home.
Oh, yeah.
Because she didn't want to go to school, or they still ask me today, can you retire because we don't want to go to aftercare? And I'm like, no. Do you know how much rent is?
Yep. Oh yeah, I understand that one.
Yeah.
And then if you could tell your teenage self anything, like from your future self, what would it be?
Keep being as big as you are and stop shrinking to make other people feel comfortable. 100%.
Perfect way to wrap this up.
Yes.
Yeah.
Well, if people want to connect with you, how can they? And I'll include everything in the show notes.
Sure. Right now, my website is aliciapt.com. And even when my new website comes out, it'll kick over to the new one. So if you look up aliciapt.com, that's probably the easiest way. And from there, you can fill out a phone or an email request, and then I schedule phone consults. So I do 20-minute phone consults, which is a really great way to just chat on the phone about what's going on with people and what they're looking for, and if we're a good fit.
Awesome.
Beautiful. Thank you so much for joining us.
Thanks for having me. This was fun.
Yeah. Take
Awesome.
care.
All right. Bye.
All right.
Thanks everybody for listening. You can find us at Born Wild Podcast on Instagram. For inquiries or feedback, you can email us at bornwildpodcast@gmail.com. You can find me, Emma Ray, on Instagram at Emma Ray, REA.
Sophia at sophiabirth.com.
And me, Leah, at Bay Area Home Birth.
We would really appreciate it if you would rate and review us on Apple Podcasts. It helps us reach more people. And as always,
Stay wild.